wound healing. So before we start, first we have to tackle two things. We have to know what is diabetes and what goes into the body. What does the body do when it heals a wound? So first of all, I think it's common knowledge that diabetes is a blood sugar disease where the body either does not produce sufficient or any insulin, or it may also be unable to use insulin effectively to change glucose into energy, resulting in an increased glucose, blood glucose level, or it may have trouble maintaining blood sugar levels in the body. So now that we know what diabetes is, what does the body do when it heals a wound? Well, there are 4 stages to wound healing. The first is hemostasis or blood clotting. So obviously when you get a cut, the first thing you want to do is you want to stop the bleeding to prevent blood loss. And what happens in the body is that the body actually secretes platelets which stick to the site of injury, and these release a chemical that promote clotting. Plasma proteins called fibrinogen produces fibrin that forms a mesh to trap platelets and other cells in the blood, causing clots to form and therefore creating what you would normally call a scab, right? The second step of wound healing is inflammation, and this is what we normally see as the body creating the redness and swelling and maybe some pain or itchiness in the area. And this causes the wound to contract, preventing further blood loss, and it also allows the body to transport cells to repair the wound, such as white blood cells, growth factors, nutrients, and enzymes. And it is a normal part of wound healing. However, if it becomes prolonged or goes on for too long, or it's too much, then it can become an issue, which we will see later with diabetic wounds. The third step of wound healing is proliferation, where the body starts to rebuild new tissue and the wound contracts and angiogenesis takes place. So angiogenesis is actually the growth of a new network of blood vessels to allow for tissue granulation or new tissue to form, and allows this new tissue to actually receive enough oxygen and nutrients. So you might observe when you have a wound healing that healthy granulation tissue is pink or red with an uneven texture that does not bleed easily. However, if you have pre-diabetes or if you are diabetic, the granulation tissue might look dark and it might not look healthy. And this can be a sign of infection, ischemia, or poor perfusion. So ischemia is when there's poor blood circulation. And in the final stage of proliferation, the epithelial cells, which is the top layer of your skin, it resurfaces the injury to cover the wound. And the final stage of wound healing is called cell maturation, where the newly formed tissues mature into stronger skin cells, so to speak. It's also known as the remodeling stage, and this is where collagen is remodeled from type 3 to type 1 and the wound fully closes. It normally takes about 21 days, but it can continue for a year or more. So what happens when this process fails in the sense where it does not progress properly through the steps? Well, it can lead to chronic wounds, and the risk factors for chronic wounds include venous disease, where you have problems with your blood vessels, infection, diabetes, as well as metabolic deficiencies in the elderly, where you don't get enough nutrients. So now that we know what diabetes and wound healing is, how does diabetes actually interfere with wound healing? Well, first of all is glycemic control, which is where your body is unable to control blood sugar levels properly. And hyperglycemia, or having a high blood pressure, has been correlated with impaired wound healing. Being obese, if you have too much weight, you might, even though you are obese, you might actually have poor nutrition, or you might be malnourished. So therefore, if your body's malnourished, your wounds won't be getting enough nutrition. It can also increase the risk of an infection. It can decrease relatively it can also decrease, may affect your blood supply to the wound. And there also might be increased tension around the newly formed wound edges, meaning that even though your body has created the wound edges to start the process of healing, the excess weight may actually pull on it and cause it to break before it is strong enough to hold together. Another complication from diabetes and wound healing is neuropathy. So neuropathy is when your nerves start to die, and it affects your sensory, motor, and autonomic function. And sensory neuropathy, where you're able to sense like in your fingers and your toes, is a single most important risk factor in the development of diabetic foot ulcers, which is one of the most common reasons diabetic patients have amputations. Because when your nerves die, especially in your foot, and you don't check consistently or thoroughly, you might miss small wounds, might even be just a small cut or an ulcer that can proceed into more serious ulcers and become a chronic wound. And if this chronic wound is not treated, it can become gangrenous, or it can accumulate a lot of dead tissue, and this can spread to healthy tissue, eventually resulting in the last resort scenario where your healthcare professional might recommend an amputation. And this particular complication can be prevented by knowing your disease. So if you have diabetes, definitely know your disease, know what can happen, have daily feet checks for any minor changes that may signal ulceration, and wear appropriate footwear, especially because with diabetes you are at a higher risk of nerve damage or neuropathy, as well as reduced blood circulation or ischemia. So when neuropathic ulcers are free from infection, they have a granulating wound bed, meaning that they actually do heal a bit slowly, but autonomic neuropathy compromises the blood supply to the capillary plexus of the foot, thus delaying healing, meaning that there's insufficient blood supply to the wound, and therefore your wound doesn't get enough water, doesn't get enough oxygen, not enough nutrition. This delays wound healing, and if this wound healing is delayed for too long, then this leads to chronic wounds, which as I mentioned, I think a couple of times, it's a big complication. So next complication is ischemia, which, as I may have mentioned earlier, is poor blood flow to a certain part of the body, be it tissue or an organ. They actually have a name for this, a peripheral vascular disease, or PVD. It typically coexists or happens at the same time with neuropathy. And this is actually a blood circulation disorder which causes the blood vessels outside the heart and brain to narrow, to be blocked, or to spasm, meaning that it reduces blood flow to an area of the body and your circulation is impaired. It may affect the smaller blood vessels of the lower limbs in diabetic patients, resulting in changes to nutrition and thermoregulatory function in the area, as well as delayed wound healing. So thermoregulatory function is important because it's how your body regulates temperature, and it's through the blood. So if you have poor blood circulation, therefore you may feel cold even though it's hot, or you may feel excessively warm. Yes. All right, and last most common complication is infection. So this can be due to a compromised immune response, and most often wounds in diabetic patients are polymicrobial, that meaning that there are many different microbes in the wound that can affect the wound healing. So what are the current treatments of diabetic wounds? Well, first let's talk about prevention, which is by doing daily checks of your peripheral regions, so your feet and your hands, especially your feet, to make sure there are no nose changes. And if there are changes to your peripheral region, then you would want to prevent infection by cleaning the wound and covering it with a clean bandage daily. You would avoid being barefoot, and if it does become infected, you may be prescribed antibiotics by your doctor. Depending on the size of the wound and the severity, it may require debridement, where the doctor or the nurse may remove the dead tissue which has built up, and you don't want this dead tissue to build up because it can promote buildup of bacteria, toxins, and increase the likelihood of having wound infection. And if you have a really severe wound, it may also result in hospitalization. So yes, that is those are the complications of wounds in people with diabetes. Thank you so much for